Many patients do want natural looking lips, and is it possible with hyaluronic acid fillers? It certainly is, but there are several factors to consider, and in this video, I'll address all the issues. The first point is for the injector to understand the natural anatomy. That is, identify the lip subunits such as the vermilion border, tubercles, philtrum, and cupid's bow. It must follow the patient's natural proportion, with the upper to lower lip should generally be about 1 to 1.6, but this varies greatly with ethnicity, gender, and age. So not everybody has the same proportion. The next factor is super important with product selection. In the beginning, we always use a soft, low viscosity HA filler designed for lips. These have high tissue integration and low G prime. One must avoid the overly stiff fillers, which can create lumps or unnatural shelf look. The next step has more to do with strategic placement. Most training focus on volume, but the first thing one should focus on is the definition, such as the vermilion border, the cupid's bow, before we consider bulk. We must frame the lip within that context. So add volume mainly to the tubercles rather than the whole lip indiscriminately. And one must avoid filling the lateral third of the upper lip, otherwise we'll end up with a duck lip. Technique varies. One may use micro aliquots, small threads, droplets, or fanning technique. The depth is usually in the superficial submucosal plane. Avoid boluses in the deep mucosal to prevent nodules or unnatural protrusion. Consider using cannula for lateral lips and needle technique for the cupid's bow and the tubercles. Many beginning injectors get the balance and ratios wrong. One must harmonize with the perioral features such as the philtrum length, the dental show, and the chin projection. And one may be necessary to correct the perioral lines for overall natural effect. One must avoid migration and overcorrection. Injection in the correct plane is paramount. Limit filler volume to one session, usually less than 1 ml, and then reassess in 2 to 4 weeks later before adding more. Be very conscious of the patient's age. Younger patients require a subtle enhancement of natural shape and hydration, whereas the mature patients require correction of volume loss, periorbital support, rehydration, and a gentle lift. It is very easy to dismiss the patient after injection. However, one must remember to assess the dynamic movements. Always check at rest and in animation, such as smiling and speaking. Lips must look natural in motion, not just at rest. Safety must always come first. Know in detail the vascular anatomy and have hyaluronidase on hand for complications. Remember, the aim is to create natural results, and this comes from respecting proportions, using minimal products, and enhance rather than changing the shape of the lips. If you require any training on anatomy and watch different techniques being used, then refer to our website on ASI, Aesthetic and Skin Institute. I'd love to hear from you if you have any questions. Please subscribe, share, and comment.